Introduce himself. This is Alex.
Hi, I'm Alex. I'm the Specialist Seating Advisor for the South West.
And Rebecca will be leading the presentation.
Good afternoon, sorry.
Yeah, time does fly.
Yeah, it does.
Just before we start, just to let you know that just because of the number of people we have attending today, we can't really take questions as the presentation progresses. But if you'd like to use the chat feature, at the end we'll try to come back to the questions and answer as many of your queries as we possibly can. Just to let you know what to expect, the presentation is a mix of some PowerPoint slides and some practical work that we'll have a look at the chairs, and we'll apply some of the theoretical input from the slides to the actual chairs themselves. Okay, so what you'll see to start with is just like a PowerPoint slide with Rebecca talking over that. Don't expect to be seeing us in the background, okay? But we'll come to that, and as we move through the presentation, we'll have a chance to look at product and explore the theory in a practical setting. Okay, so we'll start. I'll hand you over to Rebecca.
Thank you. Just going to get the presentation up. Just quickly, I'm, as Les said, I'm Rebecca. I'm a clinical specialist at Careflex. I'm a physiotherapist by background, and I was fortunate when I qualified many years ago to specialise straight away into learning disabilities and neurology. So postural management has been my main objective throughout my practice, and I'm really passionate about postural management and specifically specialist seating. As Les said, we're going to start by looking at the theory, so do bear with me as we run through these slides. It is a lot of information to get through, I appreciate, but we are happy to share the presentation. If anyone wants access to that, you can always contact us directly if there's anything client specific that you want to discuss. But I really wanted to do this theory aspect before we go into the more practical to really drive the importance of postural management and specialist seating specifically. I know we've got a mix, is that right, Les? We've got clinicians, care homes,
yeah, we've
staff.
got OTs, physiotherapists, staff from the NHS, social services and care homes and care home groups.
Okay, brilliant. So as I said, there's a range of experience and skills. Yeah, we'll just get started, and any questions, pop it in the chat. So if you are supporting someone within a care home setting, then undoubtedly you want to promote the best quality of life possible. Now, an understanding and appreciation of the importance of good sitting posture can help support this objective. So what actually do we mean by posture? It's essentially the way we hold ourselves or position our body segments, as you can see there, in relation to one another, but also their orientation in space. And this can be a subconscious thing or conscious decisions depending on the task at hand or certain positions that we need to adopt throughout the day and night. As a person grows and develops, they learn from and respond to information that's sent from various sources, such as visual, vestibular, so our sensory system, and proprioceptive input too, which is kind of the movement sensations from muscles and tendons. Now, damage to any of these systems, either through age, injury, illness or disease, can affect a person's ability to interact with that information. And individuals will find it increasingly difficult to achieve a good sitting posture and will present with a range of postural challenges. We're not going to run through the specifics of the postural challenges during this session, because we are going to just focus on seating and the solutions. But the website, Careflex website, has got a dedicated section to postural challenges, where you can learn more about things like posterior pelvic tilt or increased thoracic kyphosis, increased lumbar lordosis and things. So please do check that out if you want to learn a bit more about specific postural challenges. The most important part really of postural management is identifying those who might be at risk and getting timely prescriptions in place to reduce the risk of irreversible changes happening and postural deterioration coming to a point where actually we can't do much about it. When we're thinking about those who are at risk, we need to think about, of course, those who lack the physical ability to change position, but also those who lack the cognitive awareness to know that they need to change position, which might be the case if you're working with clients diagnosed with dementia, for example. and also those who lack the communication skills to convey that they need to change position. So again, for example, somebody who has a learning disability who cannot communicate that they are uncomfortable. So it's really key that we identify those who are at risk and adopt a care plan that's tailored to them. Appropriate postural management with a regular change of position is critical throughout the full 24 hours. But this session, I know we are focusing on seated posture. So if postural management isn't something that you are familiar with, as I said, we've got a range of experience and skills to do in the session today. But if it's not something you're familiar with, then do look into it, because seated posture, and we'll say it a lot, is only as good as nighttime positioning. So there's believed that a lot of problems start and begin in nighttime and then compounded in sitting. And we'll, as we go through the case studies, we'll cover that in a bit more detail as well. So as I said, focusing on seated posture during this session. Now, posture is directly related to an individual's health and well-being. An older person, especially one who is weak or frail, who's sitting in an unsupported and asymmetrical posture for prolonged periods of time, can experience pain, fatigue, dependency, poor physiological function and ill health. Now, an inability to sit out comfortably can result in them becoming confined to their bed and to the four walls of their room, therefore with the limited interaction and engagement, and unsurprisingly impacting on their well-being. I really want to drive during this session the importance of achieving and supporting good seated posture. The main objective, I don't know if you'd agree, Les and Alex, for us would be comfort.
Yeah, that'd be key.
Yeah,
definitely.
because we have our clinical objectives, and we want to promote function and physiological function and everything. But actually, if the user isn't comfortable, they're not going to use that piece of equipment. And actually, we need that compliance with the chair to actually achieve our clinical objectives. So comfort, it is promoted by proper positioning. It helps to minimize pain. And it's been shown that supportive seated posture can be effective in inhibiting abnormal tone. So if you're working with someone with extensor thrust, for example, it can help that comfort can actually help to dampen down that and then accommodate any related pains, such as with spasticity, sorry. Next, we have energy management. An unsupported posture can cause fatigue by making inefficient use of the body structure. The muscles tire more quickly because they have to work harder, which then results in greater energy consumption. Gravitational forces can also make sitting effortful for individuals who present with muscle weakness or abnormal muscle tone. Fatigue itself can be dangerous to a person's posture because it can be associated with significant postural challenges like a scoliosis or contractures or pelvic instability. Next, we have function and independence. Now, stability and postural stability, we'll mention this a lot throughout the session as well with pelvic stability. And when we go into the case studies, we'll explain a bit more. But that stability is key to encourage normal function and the promotion of independence. So freedom of movement in the upper limbs is only achieved when we have effective stability at the pelvis and trunk. And as mentioned, posture and positioning can reduce the influence of abnormal tone and reflexes, which in turn will help encourage normal movement. Another aspect that we need to be aware of is the cognitive and psychosocial factors and how good posture can influence somebody's well-being. A stable posture can encourage participation in social activities. Head control is, of course, essential for orientation and socialization, but also the development of communication skills. And an upright sitting position can offer a better line of vision for our clients to interact with their environment and be able to achieve cognitive tasks. Moving on to health. A major goal in postural management, for those of you who are aware, is to enhance the autonomic nervous system function. An inability to sit upright can result in decline in overall health and that's then reflected in a person's altered physiological function. So there could be an increased risk of aspiration, increased risk of infections, increased risk of related hospital admissions, and even early death. So posture management plays a key role in encouraging physiological function. So this is just a visual reminder of why posture management is critical, and actually identifying those who might be at risk before they get to a point where we are limited with what we can do. But trunk asymmetry, quite evidently from the image you can see there, you can see the scoliosis, the curvature and the rotation at the spine. But actually this can impair on respiration, swallow, digestion, and even cardiac efficiency, because you can imagine the compression that's happening on the internal organs. You can see the position of the neck and head and how it relates. So by achieving an upright sitting position, we can facilitate a more normal swallow pattern. We can improve components of eating and drinking, and even provide an optimum position for respiratory and circulatory function, which all then reduce the risk of ill health. Another key part that we're going to mention quite a bit today is pressure care. Posture and pressure are inextricably linked. So body positioning has a direct influence on the pressure going through specific body sites. High interface pressures will cause the skin and any underlying tissues to become compressed. This means that blood can't circulate and the cells don't get the vital oxygen and nutrients that they need. The body can only withstand these high interface pressures for very short periods of time. And when the loading of the tissues is unequal, for example, if you're working with someone with a pelvic obliquity maybe, and then that pressure isn't regularly relieved, that's when pressure injuries or pressure ulcers can develop. When they do happen, they have a profound impact on overall well-being and can be both painful and debilitating. And actually, in the older person, they're associated with a 5-fold increase in mortality. Appropriate management, or better still prevention, as we know that most pressure injuries are preventable, will ultimately improve an individual's quality of life, especially those who are vulnerable. And a key intervention that's been identified is pressure redistribution through regular positioning. This repositioning is critical for those who are deemed at risk of developing a pressure injury, as it's believed to be one of the most effective methods for preventing skin damage. So you click the wrong way there, there we go. There we go. So finally, but most importantly, probably good posture can have a significant impact on quality of life. And if we fail to protect an individual's body shape, it can result in many secondary complications that we've already run through and that we'll cover later on, things like pain or contractures, postural deformities, and increased infections, and the list could go on and on. So I really do hope that I press the importance and given an understanding of why posture management is so important. It's not just prescribing a comfy chair for that reason. It's a whole list of holistic reasons why we need to manage somebody's posture to reduce the risk of further damage to the body systems. The million-dollar question, what is good sitting posture? Now, this is the gold standard, and I appreciate that we work with a whole range of clients from mild through to very complex presentations. But what we're essentially trying to achieve is the body being conformed to the supporting surface as symmetrically as possible, the body weight distributed equally over the maximum surface area, that the body is balanced and stabilized, that also allows the individual to adjust to change depending on the task at hand. The body segments are supported and aligned as much as possible, and that the upper limbs are free from their load-bearing role. And this will allow functional movement. Specialist seating aims to offer a solution for these objectives and balancing the 4 key considerations for choosing a chair. Comfort, as we know, at the top, independence and function, postural control, and pressure redistribution. This list isn't exhaustive and I'm not going to read through it all, but essentially specialist seating will help to manage somebody's posture and pressure care needs. Specialist seating is highly adjustable with seat dimension flexibility to suit a multi-user environments, which is of course is great for care homes, which is what we're focusing on today. So let's look at the care home setting and the seating considerations. Again, reiterated it enough, but comfort at the top of the list there. Prolonged or abnormal postures can cause tension on the body, and then this can increase the risk of significant pain. Ensuring comfort through specialist seating can ultimately improve a person's quality of life. Being comfortable and feeling safe can also increase tolerance of the desired seated position and ultimately compliance, which we know is key to us meeting our clinical objectives. And if an individual isn't comfortable, then they may not use the chair regardless of the clinical benefits. Specialist seating aims to manage fatigue in care home settings, or if you're working with clients who maybe have complex presentations, then fatigue can affect all aspects of their life. It can significantly restrict their ability to engage in daily living, as well as having a negative impact on them psychologically and socially. Early implementation of fatigue management strategies into daily life is critical, and it could reduce the impact and the probability of that fatigue becoming chronic. Appropriate use of specialist seating in care home settings can encourage energy conservation, making it easier for individuals to live a meaningful life. And when we go through the case studies later, you can see some of the seating solutions to enable that. Specialist seating in care home settings can enable individuals to maintain an optimal sitting position that encourages the body segments to work efficiently. Pelvic stability, trunk alignment, foot support and head control, as we know, are all vital to health and physiological function, and postural support throughout this chair and the seating system will promote that. As mentioned again, the appropriate and timely introduction of postural management systems and equipment can then reduce the risk of secondary complications such as postural deterioration and deformities. And as we work through the case studies, you'll be able to see what we mean by hopefully correcting postures, but then maybe needing to accommodate other postures to reduce the risk of deterioration. The introduction of seating systems to care home residents at the appropriate time has been shown to facilitate psychosocial and cognitive development. Research has also shown, if you're working with individuals with learning disabilities in care home settings, maybe, that they can benefit from postural interventions because they can enhance communication skills and cognitive function, which in turn will help with learning and participation. This can also, of course, be applied to clients who you may be working with altered cognitive function to try and prolong that ability for as long as possible, maybe in dementia clients, for example. Another key consideration would be safety and mobility in falls. So generalized weakness from immobility and deconditioning can increase an individual's risk of falls. Reduced postural control can result in them sliding out of the chair or even falling during transfers. When looking at sitting posture, I'll say it again, but the pelvis must be stable and their feet adequately supported to promote that postural stability. This should also then enhance feelings of security and help keep them in the chair, and also help with compliance. We also need to look at the mode of transferring, and specialist equipment should always encourage that independence. And we'll talk about it a bit later. But I don't know if you'd agree, guys, but the need to look at the chair holistically is not just about that delivering a chair, it's about actually looking at how the user will interact with the chair within the environment.
Yeah, exactly. It's not just the seat width, seat depth, and pressure care. It's how that chair will function within the home, how the carers interact. It's like as you said, it's a holistic seating assessment. And
then pressure injuries. So gravity can trap individuals in these destructive postures, and older people can be, all those with complex disabilities can be at risk of developing pressure ulcers due to prolonged rest and immobility. The opportunity to sit out can offer this much needed regular change of position. So as we know, it's not just that one perfect posture, it's about that regular change throughout the 24 hours, which will encourage blood flow and redistribute the pressure. Equal weight distribution of the maximum surface area possible is crucial for reducing the risk of pressure injuries, and specialist seating systems aim to do that by distributing the body weight evenly throughout the chair, and then using certain functions to redistribute throughout the day, such as tilt and space. But as I said, we'll cover that during the case studies. So that's kind of the theory. There's a lot of information, I appreciate. So if there's anything specific you need to know, but I really wanted to cover that to really press the importance of why postural management and specialist seating is critical to our clients' quality of life, their health and their well-being. So what we're going to do now is a more practical session. We're going to run through 3 different case studies from mild through to moderate and complex. And I just want you to have a think along with us about the kind of seating solutions that might help. These are hypothetical case studies because we wanted to show a range of seating solutions, as we obviously don't have a specific client in mind, so we can think outside the box and think about their problem list and what we might do to help. So first of all, we have Alan, a 73-year-old gentleman diagnosed with Alzheimer's disease, becoming increasingly agitated when sat out. He's fallen asleep quickly in his current chair, which of course is affecting his engagement and interaction. And for some reason, he's now needing maximum assistance of 2 for transfers when he was otherwise ambulant. Thinking about his postural challenges, we've got discomfort, could be the reason why he's becoming agitated when sat out. Fatigue, generalized weakness, reduced mobility, and increased risk of falls. So thinking holistically about Alan and his problems that he's having, the reduced mobility, especially, and his increased risk of falls, so ensuring safety within the care home. So we'll just bring the presentation down so we can see us again. We'll run through some of the seating solutions. So as we know, with Alan, we wanted to encourage mobility, but we need to get that balance between safety, and as well future-proofing, because with his Alzheimer's disease and the risk of it progressing at the speed that we don't know, but we need to future-proof as well. So one of the options would be the Dartington, a traditional riser recline chair that can enhance Alan's independence whilst also ensuring comfort. So it can assist users, generally offering the postural support that's needed for users who still need to stand throughout the day
So possibly the most common form of specialist seating that we'll see. This is a chair from our range called the Dartington. Within our range, we can accommodate quite a broad spectrum of client needs. We can go up to a bariatric product up to 70 stone with appropriate seat width and depth. What I'm demonstrating to you here is the lift mechanism on this chair. It's fairly standard. It's what we call a push lift. Okay, so as the chair rises, you can see it just tilts forward. So bringing the chair, if you like, back to Alan's requirements, this could cause us a little bit of a problem, okay?
Especially when we think about his generalised weakness or maybe balance issues and his issues with transferring. As Len said, he might not have that ability to tolerate such an extreme push lift.
So it's really important that we consider the mechanism and how it works. So an option for Alan may be to reconfigure the chair. There's an option where we can set the chair so it'll become a vertical lift, okay? So as opposed to rising and tilting forward and perhaps causing Alan some balance issues, okay? The chair will rise vertically and it will keep the seat cushion flat and level so that Alan can shuffle to the edge with assistance and just lower himself off. It may be a more suitable transfer method for Alan, okay? If I run the chair through its range of movement, We did mention it briefly as part of the presentation, but a key feature of specialist seating is what we call tilt in space. And that's what this chair is just doing, okay?
If we bring that back to Alan, because what we've said about Alan's postural challenges is that he is experienced fatigue and general weakness, and tilt in space, as Les said, is a key part that can help manage this, because we can take gravity away for a period of time, allowing them to rest and recuperate before coming back upright to then engage in activities of daily living.
And the important feature here with tilt in space is that back to seat angle remains constant, okay? So coming back to Rebecca's presentation, the pelvic stability, you know, once we get the pelvis in a good position, we don't want to open up that back angle necessarily to put the pelvis into a posterior tilt. When that happens, the client can possibly start to slip down the chair.
Just worth mentioning with tilt in space, we'll probably cover it in a bit more detail as we go up to the more complex specialist seating. But with tilt, any of those functions like tilt in space and back angle recline, just be mindful they're not appropriate or safe for everyone. We do need to assess it on a client by client basis. But things like catheter use, extensor thrust and those involuntary movements, postural hypertension can have an impact. So although they are fantastic functions when they're used appropriately, we do need to be use them with caution.
And that basically the kind of conversation we're having at the moment around this is the conversation my colleague like Alex would have as a seating assessor with carers, with staff, with healthcare professionals to discuss the requirement for Alan's postural seating intervention. So we cover all these aspects as part of the service that we provide. Just rolling on, there is an option with this chair as well to provide back angle recline, okay? Now, we'll cover this in a little bit more detail when we come to the other products. That can cause us problems. One of the issues that was highlighted for Alan was comfort or discomfort. Sometimes back angle recline can help a little bit with comfort, okay? So another word we use a lot of in specialist seating is compromise. So sometimes we need to reach a compromise to achieve postural support and comfort. So as I bring this chair back into its upright position, you can see it's what we call a link mechanism. So the leg rest rises as well, or in this instance now it's coming down. I think we may need to consider lateral support for Alan, because the way that the chair is set up at the moment, we just have a flat back, okay, which may be quite comfortable. But if Alan nods off to sleep,
especially with his generalised weakness as well.
Yeah, or perhaps he has issues with lateral support, we could find Alan just drifts across, okay? And we are trying to keep Alan in this midline position within the chair. So we look at what accessories we could use, okay? And with the Dartington, we could just strip out the back section. And we could just pop in a contoured back. Now you can see the shaping in this back. When I pop that into the chair, it's now going to bring me, it's going to prompt me to sit in that midline position, yeah?
That's the key word there with prompt. We don't want to take away from Alan's independence either. So it's that compromise and that fine balance between giving too much support, but also prompting for that trunk alignment and upright position.
That's right. And as we look at the chairs, they kind of range from mild to moderate to complex in terms of postural support. And we still really at the kind of mild side of postural support at the moment, okay? You'll notice I could just take the cushion out, okay? What you'll find with our range is that it's quite a modular range. So, you know, it may well have been that initially comfort was key for Alan's chair and the flat back was perfect, okay? But over time things changed and we're thinking that a lateral back would be better. We don't change the chair, we just change the cushion. We can just upgrade, okay? Just to give you an indication of the flexibility, we can take some padding out of the back, okay, to tailor the backrest specifically for Alan, okay? You'll see sometimes here that the little wings that give us lateral support can be a little bit too prominent and may have the effect of pushing somebody forward in a chair. Okay, we can open those wings. And again, take some of the padding out to fine tune and to adjust it specifically for Alan.
One of the issues that we do need to consider with Alan is obviously his diagnosis of Alzheimer's disease, and I'm sure Les will run through the controls. But what we might find is actually he doesn't have the cognitive ability or the capacity to safely manage the controls independently.
So typically, a lift and recline chair will come with a set of controls like this, and back angle, tilt and space, leg elevation, okay, all controlled here. But this Alan may or may not perhaps be losing the cognitive ability to help control the chair, and that may be placing him at risk. So what I'd like to do is to introduce you to a new or a second type of chair. This is a chair called the Hydrocare. Support ring chair as well, okay? Comes on wheels. The chair is made in a range of seat widths and seat depths, okay? Sorry, seat widths and seat to floor heights. And that will be tailored specifically for Alan's needs, so we can make sure that his feet are well supported. It's a nice snug fit, okay? Helping to maintain and prompt that midline posture. The other thing we can do with this chair, now we're adding a little bit of complexity to the postural support. We can adjust the seat depth specifically for Alan.
One thing that we'll always come back to is the basic seat dimensions and setting it up for the user, because regardless of somebody's postural presentation, me, for example, I don't have any postural challenges. If I was to sit in the chair that was the incorrect seat depth, it would force me into a sacral sit-in. So we always take it back to the basic seat dimensions, because that's key, setting it up for the user.
That's right, and somebody sacrally sitting is one of the most popular kind of postures or presentations that we see, and it's often because that seat depth is too long. So with the Hydrocare, we can adjust the seat depth, and the way that I do that is that below the seat here is a lock mechanism, okay, and I can release that lock. That will allow me to shorten. Okay, and we adjust that specifically for Alan's need. Okay. Back angle recline on the chair, so that's controlled here. Little lever. Squeeze the lever, and we can adjust the back angle comfort. Back angle
energy management then as well.
But again, coming back to back angle recline, it can cause some issues for us, and we'll have a little look at that when we come to the other chairs. Just a quick tip for you. I guess a lot of you may be working in an environment where you've already got some Careflex chairs, okay? And every Careflex chair will come with a unique serial number. There's a little silver label on the back of the chair. Make a note of that number. If we need to review, or if you need to adjust or adapt the chair for a client, for a new client, as long as we have that serial number, we can tell you the exact specification of the chair. What that will mean is that if you call Alex out, we can make sure that we bring along the right accessories to adjust and adapt the chair for you and look perhaps to fit that chair to a new or a different client. I'm just going to spin the chair around just to show you another key feature of this type of chair.
Especially considering Alan, who might have good days and bad days with his mobility and things.
So in an ideal world, Alan will stand and be encouraged to walk back to his room at the end of the day. It may be that some days, things aren't quite as good, and perhaps we need to wheel Alan back to his room. What's really important on a chair like this then is that foot support, or in a sense, it's protecting the foot, okay? So as we push the chair, because Alan's feet are flat on the floor, we need to make sure that we raise the foot off the floor by using the foot plate to make sure that Alan's feet aren't dragging along the floor. The last thing we'd want to do is give Alan a blister just by transferring him from room to room, okay? So that's a really important feature of the chair. Other accessories we could add to the chair for leg support would be a block leg rest.
Which will help to offer a change of position as well, then, especially if you're combining that with a background recline, as long as it's appropriate.
And perhaps a tray as well, okay, for function. Okay. So, excuse me, just find that there. That covers Alan, I believe.
Yeah. So, Alan, as I said, mild presentation. So what we can do now is just get another slider to move on to maybe a more moderate presentation. And what we've got is Mary, 76-year-old lady, diagnosed with Parkinson's disease, presenting with flexed posture and leaning to one side. Currently trialing standing hoist. Mary is semi-ambulant, so we can look at that in the chairs just to see what kind of options they are. But they are now trialing standing hoists. And carers are also noticing redness over the sacrum and thoracic region and Mary's heels. In terms of her postural challenges, reduced core strength and postural control, posterior pelvic tilt, increased thoracic kyphosis, which can be quite typical in Parkinson's disease clients. Mary is experiencing fatigue, and then of course an increased risk of pressure injuries due to her posture, but also the prolonged sitting as well. So this might explain why carers are noticing this redness over the sacrum, and then the thoracic kyphosis could be actually causing the redness over the thoracic region of the back. So what we're thinking with Mary, if we pop back up on screen, in terms of seating solutions, Mary would also be a candidate for a rise and recline because of the semi-ambulant. However, due to some of her more complex postural presentations, we might be thinking more along the lines of a hydrotilt.
That's right. So the hydrotilt chair is again a tilt and space chair. Okay, that's 30 degrees of tilt, and that's controlled at the rear of the chair with the lever there. Okay, just press the lever, adjust the chair, and release when you're in the most appropriate position for your client.
So this will be key for Mary for her sacral sitting, the sliding forward in the chair, but also the pressure redistribution to try and reduce the risk of those areas becoming problematic.
Now, with the hydrotilt, to help with pelvic stability, we can adjust the seat depth and the seat width. Okay, the way that we adjust the seat width is just by changing what we call a saddle arm, and we put a thinner or a thicker arm on the chair to increase or decrease the seat width. The seat depth is adjusted at the rear of the chair. Just a little lever here, okay, which is locked. When I press that lever down, I have a handle on the other side of the mechanism. Push away from me to pop the brakes on. Push away from me to increase the seat depth, and bring towards me to decrease the seat depth.
Now, this would be key for Mary because she is presenting with that redness of the sacrum, so that could be down to the incorrect seat depth on her current chair. So we're making sure that we change the seat dimensions and tailor them to Mary, that we try and, as I said, get that pelvic stability, but also reduce the risk of pressure injuries. Yeah,
and I think for back support for Mary, I think there's an indication that we probably need a waterfall back.
Because of her increased thoracic kyphosis. If you imagine that curvature of the spine, I mean, it could be correctable, but in some cases, that fixed posture, it could be, that kyphosis could be fixed, in which case you need to look at it, as Les said, more of a waterfall back.
So what I'll show you is two things. First of all, on the chair that I have, as it's set up at the moment, it's a contoured back. That contoured back would help to keep Mary in that midline position, okay? But we need to accommodate, I think you said, as a kyphosis.
Yeah.
So the option we have there is to fit a waterfall back to the chair. I'm just about to do that, but what I'd like to demonstrate to you is how quickly we can adjust and adapt these chairs as well. So you may well have one of these chairs with one resident, may need to go now to Mary. The original setup was with a contoured back, which worked really well for the resident. Mary's needs are slightly different. We need to adapt the chair. So quickly take the back off. This is our pressure care system, okay, that sits in the back of the Hydrotilt and the seat of the Hydrotilt.
And we'll go into a bit more about pressure management systems within the chairs after we've done the case studies. There's another thing we have to remember to talk about, Les, is the auto tilt.
That's correct.
So there's the auto cells that Les is removing, and lozenges, and those lozenges can actually be used in other areas of the chair, maybe to get some lateral support behind the back support.
So then I just pop in the waterfall back. You can see just how quickly we can just change the chair setup in between users.
So if you imagine Mary was sat here now with her increased thoracic kyphosis, what we want to focus on is obviously the thoracic region, the middle section.
So what we can do with this section, and it's an example of what we call a tailored solution possibly. There's a lot of detail we're trying to cover here this afternoon, and what I'd suggest is that after the presentation, if you have a quick look at the website, it'll go into a lot more detail on the chairs, and it'll give you a better understanding of how we could use the accessories. One of the things that we can do here with the thoracic section, for example, is a tailored solution, maybe to segment the cushion so that as opposed to one cell of fibre fill, we have three. So the centre section is slightly less dense, and that will help to accommodate that thoracic profile that Mary has. Okay.
Yeah, to try and have more equal weight distribution so that we're taking that pressure point from the apex of the thoracic region and hopefully then reducing those red areas. And
Rebecca did mention a little bit earlier about one of the motorised functions that we have. All the chairs with me or with us today, apart from the Dartington, are manual, okay? So that we can adjust them with a lever at the rear of the chair. Just press, push and release. With the powered version, it obviously would come with a handset and would give us control over tilt in space, leg rest, and where we have it, back angle recline. There's a third feature, or a fourth feature, which we call auto tilt. An auto tilt is a regulated motion. And the regulated motion is you press the button and the chair will slowly cycle through its range of tilt in space. And that's an example of our kind of very high-end pressure care, because we've achieved the pelvic stability with the seat width and the seat depth. We have the pressure care in the seat cushion. We have foot support, which I'll mention in a second. Plus, we now introduce that movement of the chair, okay, to redistribute pressure every time we adjust the tilt in space angle.
It's a good point about actually covering the foot plate, because it can be something that's often overlooked, and actually 19% of our body weight goes through our feet in sitting, so it's a really critical part of the chair to ensure stability and postural control, especially in Mary's case as well, to try and increase that postural stability and energy.
Because what you'll notice, as we use tilt in space, inevitably it'll raise Mary's feet off the floor. As we've already said, it's critical to support the feet of our residents, so we now have to use a foot plate. There's a flip down foot plate on this chair. An elevating leg rest. We can extend the length of the foot plate if we have a slightly taller client. The foot plate is also angle adjustable. When it's not in use, we can flick that away.
Which is great for standing transfers, or to get the standing hoisting position as well.
Or we could even take that away completely. Now, as we talk about foot support, and there's a possibility that Mary maybe stand transferring. It's an option with us to look at the smaller version of this chair because it'll give us a different seat to floor height.
But still the adjustability for seat width.
Exactly. So we've got the slightly hybrid version, if you like, where we can have various seat to floor heights, various seat widths and various seat depths on the chair. So it just gives us a little bit more scope to kind of meet Mary's requirements in terms of posture.
While
anything else?
you were mentioning the leg rest, at the moment we're not seeing any more complex presentations, but Mary, because of her muscle stiffness and rigidity, contractures might be an issue in the future. So something like a negative angle leg rest
So-
might then future-proof the chair.
If I just come back to the medium chair, it's the same feature on a small chair, but there's 90 degrees there. May well be that Mary has that limited range of movement in the knee, perhaps slight contractures. We can push the foot plate back down to achieve an angle of 65 degrees to accommodate that contracture.
And while we're on the leg rest as well, I know we've spoken about the importance of getting back angle recline and tilt in space appropriate, but actually leg rest elevation as well. And Les mentioned it there, it's really key to know how much range of movement there is at the knees to make sure that they can tolerate leg rest elevation, because if that range of movement isn't there and we elevate the leg rest, it's just going to pull them into that sacral sit-in. So it's another key dimension that we need to check.
It is something we see quite often, unfortunately, is that people don't appreciate that that resident has that limited range at the knee. And we'll go to visit somebody and we'll see the leg rest in that position, okay? And our resident doesn't have the ability to extend further than 90. So the only way that that person can sit in the chair, I can't adjust it, it's like so. I'll probably end up in that position there, bringing myself forward out of the chair.
And it's really key here to then think about nighttime positioning as well. Because if somebody is in bed in a sideline position for 10, 12 hours at night, and then we're expecting them to sit out comfortably, we really do need to make sure those both interact with each other. Yeah, so that's Mary.
Brings us to Tom.
Yeah, so now moving on to Tom, we'll just get this quick slides up again. Now we head into more complex presentations. So Tom, 81-year-old gentleman, diagnosed with vascular dementia, presenting with frailty. He's non-ambulant, so he's hoisted for all transfers. He's unable to position independently and is experiencing recurrent pressure injuries and respiratory infections. In terms of his postural challenges, presenting with generalized weakness, that pelvic instability, so with sacral sit-in or posterior pelvic tilt, which Les commented is probably one of the most common challenges that we come across, an increased thoracic kyphosis related to that posterior pelvic tilt, and then his recurrent infections causing impaired or due to impaired physiological function with an increased risk of ill health and hospital admission. So the goals here are really to promote physiological function and protect his health and well-being. So we can pop back on screen. And then what we're thinking with Tom is then something more like the HydroFlex.
So what we're doing is, you'll have noticed that we're moving through the range of chairs that we have with us in terms of complexity. So we started with mild, something more moderate. Now we're looking at something more complex with the HydroFlex. And just before I kind of run through this chair, just to say that if you check the website, there's another complex chair within the range called the SmartSeat Pro. And if this chair is of interest to you, you may well want to look at that chair as well.
Especially if you're working with a very complex postural presentations of deformities, maybe someone with cerebral palsy, where you actually need a bespoke individualized back section that's multi-adjustable to target all the different sections of the spine and pelvis. So yeah, check out the SmartSeat Pro for that.
So the HydroFlex, again, is a tilt in space chair, 30 degrees of tilt. The difference with this chair, the HydroTilt was 30 degrees as well, but the difference with this chair is that it tilts ever so slightly forward. So where that's really helpful is where we have that client who still has the independence to stand, okay, but needs the complexity of a more posturally supportive seating system, okay? So if I just tilt that chair back, there's 30 degrees of tilt. The chair has a built-in leg rest and foot plate. Foot plate just hides away behind the calf, but we can drop that down. Can elevate the leg rest. As I said, this is a manual chair. We can power the chair as well. Angle adjustable. Adjust the foot plate to suit Tom.
Should be key for Tom, especially because he's unable to change his position. Without that foot plate, he might be at risk with gravity with a foot drop. So we need to make sure that we are maintaining that plantar position. Even though he is non-ambulant, we still need to protect the joints as well, and it just make postural stability and pressure distribution much easier if we can get that plantar position.
We can extend the length of the leg rest if need be to accommodate Tom, or we could make that a little bit shorter. You'll see now additional support. We have a channel leg rest. Let's flick this down, push this away. The chair will come in a range of seat widths and seat to floor heights, and an adjustable back. The back adjusts in a similar way as the Hydrotilt does. As we move up the back of the chair.
So thinking back to Tom, where the key thing here is physiological function and reduces risk of infections. Possibly his chest infections are from aspiration, so we need to then think about maybe holistically where he's eating and drinking and how we protect the head and neck position. With Tom, same with Mary, he is presenting with an increased thoracic kyphosis, but maybe a bit more complex, more fixed, in which case the Hydroflex offers an additional function with articulating headrest.
Articulated headrest and the contoured back. Yeah. The contoured back on a Hydroflex is more supportive. It's a deeper sculpted shape. There's a further option if we're dealing, if Tom has a fixed postural issue. We can add, this is a flat back, but we've now got adjustable laterals, okay?
So if you imagine an asymmetrical spine, maybe a scoliosis, where actually we need differing points of support, maybe on the curvature of the scoliosis on one side and then prompting at lower regions on the other side.
Yeah, so you can see quite an asymmetric posture here, perhaps accommodating a scoliosis on the right and a second point of contact on the left. These can be adjusted in and out, up and down. If need be, we can take the lateral away if we need to get rid of a lateral for a transfer, possibly. That will just quite simply lock back into place. There's only one place after we've set it where that lateral can go. Okay, so that's a flat back with adjustable laterals. We've already mentioned tilt and space and leg rest.
With pressure redistribution and pressure care for Tom, I mentioned this earlier, but the care plan is going to be really key because he hasn't got the ability to change position himself. He needs that full support to achieve that regular change. So the care plan with photos, if possible, would be a really key part for Tom. And because this is more complex, I know Les mentioned it, it's not just about delivering the chair, it's actually that trial and review process as well, where he might deteriorate and we need to then adjust the chair with those changes. That's
correct. I mean, as well as being a manufacturer, we see ourselves as being the provider of a service where colleagues like Alex would be visiting and helping to evaluate and reassess if need be and reset the chair as Tom's needs change over time. Further feature or function to look at within specialist seating. With a more complex chair, we've now added back angle recline. Back angle recline on the Hydroflex. It's just there. Tilt in space is controlled separately, okay? So we can set the back angle and adjust tilt in space separately. Typically what we would be doing would be setting up the back angle.
Just remember, it's really got to be used with caution, this function, because it can increase those involuntary movements, extensor thrust, and offset the pelvic stability that we've worked so hard to achieve.
And after we've set the back angle, we lock it and hide it away so that our carers just see the tilt and space. And as we said earlier on, tilt and space is a posture neutral movement. To accommodate, this may have been a help for Mary as well. To accommodate that kyphotic posture, we can shape the back, okay? There's a range of settings to adjust that to.
So if we can't correct that kyphosis to bring the body into the chair, we need to try and bring the chair towards them to get that pressure distribution.
Was there anything else with Hydroflex?
It was just the water cell technology I think we wanted to cover. So thinking about pressure care and then specific to Careflex and our pressure redistributed system in the chairs would be, I know you heard us mention the water cell, but I thought it would be useful just to actually show you the cushion itself.
So what I've got here is a cutaway version of a cushion that's on all the chairs, or all Careflex chairs as they leave the factory. What we have is a 4-way stretch, breathable fabric. The fabric is called Dartex. Memory foam, high elastic foam, and these are water cells. Okay. And what happens is the 4-way stretch fabric does what it says on the tin and stretches and allows the bony prominence or the high pressure point to become absorbed into the seat cushion. Memory foam reacts to the body heat and the water displaces. So quite simply what happens is the high pressure point is absorbed into the cushion. You'll see the surrounding surface rises and spreads that pressure over a greater area. That's classified as high pressure care. We've 2 documents which you can download from our website to give that some efficacy. Okay, one is a publication by Salford University. The second is a pressure mapping exercise. Okay, and that's those 2. You'll find those on our website, or if you need to, we can send those out to you. And just to say, we don't supply the cushions separately. We supply them only for use on our products because all the work, all the evaluation is done as the cushion is seen as part of a seat system or a pressure care system. So that system incorporates seat depth, seat width, foot support, lateral support, and head support, as well as the pressure care cushion the person sits on, plus using tilt in space, back angle recliner.
Yeah.
I
think that was it on the case studies. I'm conscious of the time. I just want to run through and just summarise really our top hints and tips. It is a general or a gold standard objective, but if we are aiming for this type of thing and trying to get this good posture with our clients, then we are definitely on the right track. So first of all, a comprehensive seating assessment with an experienced seating assessor and a health and social care professional is critical, and this will enable the appropriate seating prescription. Specialist seating should be used, as we mentioned, as part of a holistic 24-hour programme that also encourages a regular change of position to manage both posture and pressure appropriately. During the provision of specialist seating, the objective is an upright and symmetrical sitting position with all the body segments considered and supported. The chair must be set up for the individual user, so the correct seat depth, width and height are critical, as we know, for postural management and pressure care. The pelvis is the foundation for a good sitting posture because it dictates what happens to the body segments above and below, and we're aiming for stability in all planes of movement. The position of the thighs then help to further stabilise the pelvis, and we're aiming to keep them level and fully supported, which will also encourage then equal weight distribution. We're aiming to support the trunk in an upright and align the spine as much as possible to reduce the risk of postural deterioration, but also promote that essential physiological function. Pelvic stability and trunk functionality are dependent on adequate lower limb support. So don't forget the feet. We need to aim to align and support the lower legs and the feet. The upper limb support is essential to prevent drag and relieve stress on the neck and shoulder muscles, but it's not there to support the trunk. So if we take the upper limb support away, the trunk still needs to be supported. So we might need to take a few steps back to make sure we get that, and then we can look at the upper limb support. And finally, which is sometimes the biggest challenge, I don't know if you'd agree, that head and neck support, which can be a bit of trial and error, but we need to try and get a midline upright position to enable interaction with the environment, but also for safety reasons as well.
We didn't really touch very much on our head supports and head rests. But again, if you want to refer to the website, you'll see we have a wide range of soft and foam block headrests, plus a chair like the SmartSeat Pro would provide additional level of head support as well.
Yeah. I don't know if there's any questions popped up, Alex. No?
No questions from anybody? Okay. If there is, or if there are any thoughts after the presentation, just drop us an email. Just to run through part of the service that we provide. As I said, we're a manufacturer, but we do see ourselves as a service provider as well. If you're working as part of a nursing home group, we have a service which is kind of tailored specifically for that market called white glove service. I can send you more information on that. Just drop me an email on it. Just run through the benefits of working with us as a group, if you like, as opposed to individual care homes. Just to give you some reassurance, when you buy your product from us, the product will come with a lifetime warranty and an undertaking from us to support that product as well. Quite often when we are involved with an assessment, it's a high need. Something is needed really urgently. So that's where our express chair service comes into play. We can get you a chair within 5 working days. And that's about it from us, really.
We've got a question there.
Oh, a question, yeah.
Can you chat through the range of cushions and what grade of ULSAT they would support?
Well, we don't have a range of cushions as such. We have the Watercell technology cushion, and that's rated medium to high.
Medical Devices Agency had done a research on it. There's also obviously the Salford. I mean, obviously it is going to be completely individualised to the user, depending on, I don't know if you guys do Waterlow, baseline scores, that type of thing. We've obviously run through the Watercell. There's the option for the contoured cushions as well. And if you are working with clients who maybe have been prescribed a specific pressure distributing system, such as a gel or an air system, we can actually do docking cushions as well.
That's right. I mean, so everything you've seen with us today is pretty much an off-the-shelf standard item, but we do have a facility called Tailored Solutions. That's just an example there of a contoured cushion, which gives you a ramp plus some profiling at the front edge of the chair. We've used Pressure Care technology now for 25 years, and we've had some great feedback on the effectiveness of the cushion, but we do recognise that everybody's different. We do work with clients who've got incredibly complex needs, and some of those needs generate the use of really complex, bespoke, third-party cushions. And we can accommodate that cushion within our seating system. Because
as we know, as we've said, it's all part of a system. It's not just that cushion. So if they have got a specific prescription and we can integrate it into the postural support that comes with our chairs, then that just increases that pressure redistribution as well. So I don't even see on screen there how the docking cushion would work. And then their particular gel or air or Roho or anything would be able to slot into that.
It could be a uniquely sculpted high pressure care cushion provided, I said, by a third party company. As long as we've got the external dimensions of that, we can provide you with the docking cushion to mount that cushion on our chair. Mm-hmm. I hope that answers the question. Anything from anybody else? No.
You can always get in touch with us anyway. If anything pops up later on, get in touch with us or email us, anything client specific.
Yeah.
Any questions about the actual presentation,
Okay, well, if there's nothing else from anybody, thank you for your time. I hope you enjoy the rest of the day. Tomorrow's Friday.
Yeah.
The weekend's here. So, thanks for joining us.
Thank you very much.
Bye-bye.